Thank you for joining us for this Adult Education Senior University Effective Communication Strategies class with presenter Bev.
Thank you. Thank you all for coming today. We are going to be talking about effective communication strategies as someone with Alzheimer's or dementia moves through the stages of that disease. A little bit about myself. I live over in Whiting, and I've been living around here for about 10 years now. 3 years ago, I started doing, I'm a volunteer educator for the Alzheimer's Association, and I started doing this about almost 4 years ago now. At that time, I had known of one or two people who had Alzheimer's in the past. My stepmother had died from Alzheimer's. In those 3 years, the 4 years since then, oh, go ahead. Yep. In the 4 years since then, I have now a former sister-in-law with Alzheimer's. My own sister at age 85 has Alzheimer's. A brother passed away this year from dementia. And I have a very good friend who's only 73, who I have helped to find assisted living in that because she already has Alzheimer's. So as I said to the one person who was here a little bit earlier, she said she knows no one with Alzheimer's right now. I said, unfortunately, you will before long if you don't now. So as part of what I'd like to do is find out from an audience perspective, what you know, what's your experience with Alzheimer's? How many of you currently either are concerned about yourself or someone you care about showing symptoms of Alzheimer's, or your caregiving? How many of you? Okay, one is okay. Anyone on the phone that is in any of those positions in terms of caregiver or just concerned about someone that you think may be experiencing dementia?
I do have a few people that are raising their hands.
Okay, thank you. So that's what we want to, kind of try and help you if you're dealing with this, learn how to deal with. It is a very difficult disease. It is. So for those of you that are doing so, I hope you'll share your experiences because that's very valuable to people in the room. So what we're going to talk about today are the communications that take place, how communication changes through the stages of Alzheimer's or another dementia. Talk about the verbal and behavioral messages that someone living with this and how you can respond to them in a way that will make more sense for them, and identify strategies to connect and communicate at each stage of the disease. We typically talk about Alzheimer's as having 3 stages, so we'll talk about those in a minute, what those are. Communication is in many forms of communication. So we want to talk about all the aspects of communication. How do you communicate with your body, with your voice? All of these things are important to the person that you're going to be interacting with, and how you do that makes a difference. Facial expressions, all of this, you need to think about all aspects of how you communicate with individuals in doing this, because it will change them and they're going to want to, in order for you to stay connected with the person, you'll need to do that. So there are 3 stages. In the early stage, the person starts losing, because Alzheimer's, one thing we're finding out is it's different for every individual. And so you may not see exactly the same things that a neighbor who's dealing with someone with Alzheimer's sees. In the early stage, people do start losing some of their language skills. Their thoughts and feelings, their use of words starts changing. They actually lose the ability to remember words, and they may need help with that. The important thing to keep in mind as you deal with somebody is their sense of self is still there. Their need and their desire to still be the person they were is still there for quite some time. By the end, sometimes the personality seems to have changed to those who have been around them, and they see a different person than they used to. But in the beginning, it's very important. The other thing in the beginning is a lot of people are in denial. None of us want this disease. Absolutely none of us want this disease. So we're often in denial in the early stages. My friend, it took me 4 to 6 months to get her to go to the doctor when I was seeing issues. But just to get her to go to the doctor to see what the doctor thought took me 4 to 6 months, because she didn't want to admit that she was having problems with some of this communication things. As they move into the middle stage, you'll see even more decline in their use of words and sentences. They may start relying more on their tone of voice, and it's more important for you to do that too, because they're having more trouble with it. But they need to stay connected. In the severe stage, the late stage, it becomes much harder for them to communicate using words, and they'll become much quieter, and you need to connect with them through their senses. And we'll talk about how you can use all 5 senses as a way to communicate with them. So when we look at the early stages, we're going to start there. Difficulty finding the right words. How many of you have had to deal with someone who they can all of a sudden not come up with the word that they're trying to come up with? Yeah, I have. And what happened with my friend, I'm sitting in her apartment one day, and she's saying, if the sun is getting too bright, I can adjust that white thing on the window. She couldn't come up with the word blind. Started happening more and more. I started seeing more and more that she could not come up with the word she was looking for. The professionals call that word finding, but people have trouble with word finding. They take longer to speak or respond. And one of the things I've learned, I'm accused of talking too fast and jumping ahead. And I've had to learn, or try to learn, to slow down. My friend will tell me, you got to slow down. I can't keep up with you. Because they're starting to lose the ability to find words, and they lose their place in a conversation, and it takes them longer, you'll often see them starting to withdraw from conversations. They just don't enjoy them as much. The other thing that's often impacted in the early stage is the part of your brain that handles executive function. So they struggle with decision-making and problem solving. A simple example with my friend, and we talked with her doctor about it recently, is she kept telling me she knows she needs to exercise. You know, with Alzheimer's or dementia, the things you need to do for good health are pretty much the same as you need to do for your heart and other parts of your body. You know, eat right, exercise, etc. She wasn't exercising. Kept talking to her about it. There's a yoga class on Mondays and Tuesdays. Why don't you go to that? I'm going to. For 3 months. I finally said to her doctor, is this the executive functioning? She can talk about it, but she can't carry it through. She said yes. She prescribed physical therapy, and my friend is now exercising because she got the therapy and they created routines for her. So there are lots of things you have to think about when you're dealing with someone who's not able to communicate the way they used to. She couldn't tell me why she wasn't doing it. She kept saying, I'm going to start next week. And then next week I'd ask her, did you start? No, I didn't get to go this week. So it was a continuing thing until we finally talked to her doctor about that. You may also notice some other, as they're talking about it, that they're disconnecting from other things in their life. So that's important. So let's look, Martha, from the Alzheimer's Association.
Communicating in the early stages of dementia with the person with the disease is important. At that time, you still have language as a tool, so you can learn things about what they might prefer as the disease progresses. For example, as the disease progresses, a person might have difficulty finding words. Caregivers often struggle to know what to do in that moment. Early on in the disease, you can ask. You can say, if you ever have trouble coming up with a word, would you rather that I jump in and give you the word, or do you want me to wait and allow you some time so you can find it on your own?
So that's an important thing she mentioned there, is asking the person, what they want you to do. So my friend was starting to have, she would be talking to me and she's struggling with a word. And I could, not all the time, but some of the time I could guess what that word was. And so I asked her, do you want me to fill in the word, or do you want me to let you keep trying to come up with it? And she said, fill it in for me. So you can ask the person and see what they're comfortable with. Sometimes they want to keep trying to get it themselves. Be very clear in your communications and straightforward. I've already talked about leave plenty of time for conversations. Don't, if you need to have a lengthy conversation with them, then allow enough time for that. Don't go in at a time when, well, I've got to leave in 5 minutes, but we need to talk about XYZ. Again, they process things a lot slower, and so you need to give them more time to plan their conversations. Avoid making assumptions, and again, what we're trying to say there is, I've already mentioned, Alzheimer's is different for every person. There's no two people that you're going to sit them down and see them going through exactly the 3 stages exactly the same time. So don't make assumptions that because you've understood what happened with one person, that you're going to understand with the next person. Speak directly to the person, so make sure you're really looking at them. Try and paying really attention to whether they're hearing you and seeing what you're saying to them. Try to find out what's most comfortable for the person. My friend can no longer use text. She can get a text, but she doesn't respond to a text. So if I just want to give her some information, I could send her a text. But if I expect a response, that's not going to work. She doesn't do email anymore. But it's find out what the person is and is not comfortable doing, and that will change as you go along in time because they become less able to use technology. Make sure you're still laughing with the person, find ways to laugh. We joke sometimes about not remembering something, and my not remembering something being similar to the fact that she, well, you forget things too. Yes, I do. and so you can create some situations in which they can laugh. And be honest and make sure you really do stay connected with each other. That's very important to them, that they don't lose their friends. So that's kind of early stage. Any questions or comments from your own experiences?
Hi, Bev. We do have a question from someone on Zoom. This person says she went with a friend to the doctor's office, and the doctor asked the friend questions such as, what's your name? How old are you? Who's the president? And so on. Beyond such cognitive tests, though, is there a blood test that can be done now to identify early onset Alzheimer's?
So what she was describing, for those of you who don't know, was what they call a cognitive impairment test. And it's a very typical test. And you will see people in the early stages start not to be able to answer some of those questions. And they do get more difficult if they go through more. I'm going to say a couple things about this. Number one, no blood tests yet, but they are working on it, hoping within the next few years to come up with a simple blood test. Right now, we encourage people to, and I have a handout for those of you here, and we can get that handout online from Alzheimer's on the 10 warning signs of Alzheimer's. And we ask people to kind of look at those 10 symptoms and see if you're having 2 or 3 of them, then you should be talking to your doctor. Now, you did talk to a doctor, and they didn't do a thorough enough exam. If they didn't go ahead and diagnose. And that happened with my sister. Her daughters were seeing her start to have some of these issues. Her internist kept saying, oh, you're just getting older. Well, some of it does look like you're getting older, and some of it is similar. But that's what the handout at the back will explain to you, the difference between normal aging and if you might have Alzheimer's. Now, that handout doesn't tell you if you have Alzheimer's. It gives you the 10 warning signs so that if you're seeing them or your family members are seeing them, you do get to a doctor. What we had to do with my sister, eventually I said to my nieces, if your internist isn't paying any attention, she's on traditional Medicare, so she can go to any doctor she wants to. We found her a neurologist. And the neurologist then did additional testing. So they'll do MRIs, they'll do PET scans, and they can do lumbar punctures as a way of determining if someone actually has Alzheimer's. So there's a series of tests you have to go through, but you're absolutely correct. The first thing you have to do is get a doctor to believe that there is an issue that needs to be looked into. Up until the last few years, most people thought there was no reason to get diagnosed because there's nothing you can do for Alzheimer's. Well, that's changing. We're starting to have more medicines that can deal with the symptoms of Alzheimer's, and they are moving closer and closer to some things that can actually deal with the biology of Alzheimer's. So another reason to get it, to go and try to have it diagnosed, is you may not have Alzheimer's. You may have something else that they could treat more quickly. But it also helps for people to know if they have it, because they can plan the rest of their life appropriately, knowing they're going to have more and more forgetfulness and inability to manage their affairs. So thank you for that question. Are there any others?
I do have a comment. It just says a battery of tests by neuropsychologists, which test for memory, cognition, communication, and other psychological skills, is often used.
Yes, absolutely. There are different ways that doctors approach it, and they can also send you to different kinds of specialists. There are several, a neurologist is one, but just as you're saying, there can be people who focus more on the psychological, the psychiatrist, the psychologist, that focus on different aspects of memory. So, okay, so that's the early stage and a little bit about diagnosis. So let's look on how would it change in the middle stage? Well, in the middle stage, you start noting the things that you noticed in the first stage are getting a little bit worse. And this is where you can start hearing the repetition. That's one of the things that people really notice with people with Alzheimer's, is they repeat things frequently. So that's an important thing to watch. They may invent new words because they can't remember the old one. They may invent new words for something because they can't remember the old one. Or they may become much better at describing something, like the white thing on the window that I said, my friend said, the white thing on the window. I knew what she meant. I didn't have to stop the conversation or anything. We could continue conversing. That still happens even now. It's fine. She's still able to converse with people. But they can easily lose a train of thought. I can too, but especially people with Alzheimer's and dementia they can't keep a long conversation going. They forget things. And again, we've already said they speak less frequently. In the middle stages is when we can also start seeing people use their behavior rather than words more often. So there we get into, people may get angry more quickly. They may get more emotional. They may throw things. They may, kick things. Just their behavior starts showing their frustration with where they're at in their life. But I want to caution, sometimes we can say it's the Alzheimer's, but it could be a medication change has happened. It could be, again, a UTI, which is very common as people get older. They have UTIs, and those could cause, how many of you are familiar with UTIs? Urinary tract infections can cause, they're very frequent in older people, especially, and we do see it a lot with people with Alzheimer's. And as a result, their behavior can become very, very affected by that. They can have hallucinations, all kinds of things with UTIs. So important to pay attention to those things. At this stage, they can even have trouble following not only the conversation, but they can't even watch TV. When you think about my grandfather sat and watched TV well into his 90s. Much of his day was spent watching TV. With Alzheimer's, people often can't follow a storyline. So they no longer can really enjoy TV because they can't follow the story that's happening. So all of this becomes more difficult. So let's let somebody else named Beverly share some advice she gives to caregivers.
I would advise couples, and I usually do advise the caregiver who comes to the group and is caring for a spouse, that you take your time. Always count to 3 before you respond, because it gives you time to think about your answer and what's going on. Generally, in a marital dispute, it's quick. It's back and forth. You're quick to give an answer. When they've been diagnosed, to sit back and say, okay, you're supposed to be the one that's reasonable here. Let's change how we do this, because there's only one thing you can control, and that's you. You cannot control them in their process.
So as we go through this, it's going to become more about you as the person who's trying to stay connected to the person, trying to still be a friend or being the caregiver, you're the one who's going to have to change how you communicate, because the person is not able to, doesn't even understand that they're not behaving in the way they have in the past. And it can be very, very different how they communicate than they did than you're familiar with from previous times. So connecting in this way, again, it's very important that you are approaching the person from the front, not behind, and surprising them. That you try to get, if they're sitting, that you sit, if they're standing, you stand, so that you're at eye level with them and you keep eye contact. One of the key things we say throughout working with someone with Alzheimer's is, as much as you know they're wrong about something, they're telling you something. My mother-in-law, who did not have dementia, but she insisted for years, telling her son and daughter, we had a certain color car back in 1965, you know, and they were both like, no, we didn't. No, we didn't. And there's no point in arguing. The person with, and again, she didn't have dementia, but I can tell you right now, because of my sister, if they have dementia, you're not going to change their mind. So quit trying. Just accept whatever they've said and try to move on, because you're not going to be able to correct what they think. And pay attention to your tone. If you get angry, and I've taken care of, I've been with friends and family members with this. I do occasionally get angry and realize later I shouldn't have, because they can't control it. It's hard to always control that behavior of yours, but it is important that you try your best to do that. And then again, always taking your time and not rushing. So we have another video. This is Rebecca talking about how she did adjust her thoughts and responses.
She could sense my frustration, because occasionally I would lose my patience and I would bark at her. Why are you asking me that question again? I just answered that question 2 minutes ago. And then she would get frustrated because, you know, she was very old school, and she's like, don't disrespect me. And I didn't ask you that question 2 minutes ago. It's a new question. So phase 2 of our relationship was like, okay, that's a new question. I'll answer it again.
So again, we have to be the one that adjusts, and that's hard sometimes to accept, that you need to be the one that changes during this disease. So making sure you continue, I guess the most important thing, and I'm realizing this was my friend, I'm her power of attorney. So she's now living in an assisted living facility, and I visit her regularly, but I'm taking care of all her finances. But I occasionally give her the credit card to pay for something when we're out at a restaurant or something. So she still has a sense of independence, that she's in charge of something in her life, because I've actually got a lot of control of her life right now, all her financial stuff and all the decisions about that stuff. So it's important to try and keep letting them do as much as they can without making them. And I can tell sometimes by the way she responds to me that she's like, oh, I used to be able to do this myself and I can't. And one of the ones that I can tell you is a big one is driving. Now, she wasn't a big driver. She lived in downtown Chicago, so she didn't have a car. So she was not one that's had difficulty giving up driving. My sister, she was really difficult to get her to realize you can't drive anymore. So that's a tough one, because that's independence that's going away. So trying to keep respecting the person and understanding how some of the stuff that's happening to them is making them think about themselves, and making sure you're thinking about that and responding to their emotions. So if they're feeling sad, try to understand that sadness and why they're feeling sad, that they're feeling that they're losing their independence, and indicating that I understand that. I do understand how you feel. But let's talk about, do you understand why you can't drive anymore, and try to get them to understand that. But make sure you're thinking about the emotion behind that for the person, because it's about feeling like their life is being taken over by other people. And to some extent, that's absolutely true. Another thing we've learned with Alzheimer's that we do try to do a lot is be prepared to redirect their behavior. So they're focused on driving, for example, and you've had the conversation with them. Decide, let's go for a walk. Let's get them to go do something else, just change the conversation, because a lot of times with people with Alzheimer's, if you do that quickly, do that fairly quickly, they'll forget what they were talking about with you. It'll go away for now. It may come back tomorrow, but for today it'll be gone, and you can go take a walk and maybe have a pleasant experience with them. Redirect them. There's a different course that we have that talks about a woman who always has a basket of towels for her mother to fold. Her mother loves folding towels for some reason. So she will take the basket of towels, say, Mom, I need you to fold some towels for me. So Mom folds the towels. She'll go back in the other room, and instead of putting them away, puts them back in the basket. She's ready for the next time Mom needs redirected to something that will keep her from being negatively focused on something. So keep things that this person likes. Listening to music. Have the music ready. Like, hey, let's listen to the favorite group, and put some music on. Dance with them if they like dancing. Just have something ready to redirect their attention to something that will get them away from whatever's bothering them at the moment. So again, we're going to keep using short sentences, basic words. The more you move along on this, that becomes even more important. Making sure you're speaking slowly and clearly. Only one person should be talking to them at a time, one question at a time. And we even talk about if you've been around somebody with Alzheimer's as they progress in here, you get to the point where if you say, what do you want for breakfast? They can't answer that question. But if you say, do you want eggs or oatmeal? They'd have a better chance of answering that question when you're giving limited choices. And eventually it may just be, I'm fixing eggs for breakfast. How does that sound? And that may be all you can do, but it's about limiting the choices. So you're not giving them open-ended questions. You're giving them just a couple choices. Limiting distractions, being patient. And again, we've already talked about trying to guess or fill in words if that's okay with them, that they've said they're welcome for you to help them finish their sentences. A lot of visual cues through your hand gestures. This is where we want you using body language and things that helps them to understand what you're trying to say to them. But do avoid sudden movements. It can frighten them. Write things down. Have them use a calendar. Have them, make to-do lists. Things that will help them to remember things the next day. As we said, put answers into your questions. So do you want ham or do you want turkey sandwich for lunch? Don't refuse to repeat things. If you need to repeat it, do repeat it. Try to turn negatives into positives. So we find a lot of Alzheimer's patients, a lot of elderly, but my mother-in-law, again, she didn't have dementia. She didn't want to take showers anymore. Now, she was afraid of falling, and that happens with Alzheimer's patients too. But they still have to do it once in a while. You got to get them to take a shower. So the more positive way, and rather than saying, let's go take a shower, is to remind them that, hey, we're going to go visit Cindy this afternoon. You need to clean up for that. That's a more positive, trying to think of a more positive way to get them to do something. The other thing I sometimes do, I'll ask my friend a question, and then I'll sit and look at her face and I'll say, hey, Kate, that wasn't a test. That wasn't a test. I didn't mean to do that to you. You got to rephrase the question, or if it wasn't important, say it wasn't important. Let's forget that, move on, because she couldn't, she can't remember the answer to the question. So all of that's important to ways to help them communicate better. Important to make sure you're being empathetic as you respond, and to think about the person's reality. It's not your reality we're worried about now. We're worried about their reality. Where are they standing? What is it that you need to stand in their shoes and see if you can understand what they need to hear and understand. Focus on feelings in the middle stage, not facts. Again, they're going to argue with you about facts. So focus on their feelings and what's underneath their need to argue about that car from 1965. What's underneath that? And fine, let it go. And then we've already talked about the importance of validating and redirecting the person if necessary. Questions about the middle stage?
Hi, Bev. A participant on Zoom has a question. She says that when she retired back in 2013, she was having some of the issues related to not being able to do simple things, keeping keys straight, repeating things to family. Her granddaughter stayed overnight with her at one point, and the granddaughter noticed she was snoring and was actually stopping breathing when she was sleeping, and was very concerned about her. So the participant talked to her doctor, and actually she was concerned that she had dementia. But after talking to her doctor, it turned out that she had severe sleep apnea and needed to use a sleep apnea machine. This has turned out to be very helpful in taking care of the symptoms that she was experiencing. And so her question then is, are things like sleep apnea and other issues ones that doctors test for to rule out before diagnosing Alzheimer's or dementia?
Well, the doctor, again, if what we've said is we have these 10 warning signs, and if you go to a doctor with those 10 warning signs, they should be doing a full examination, not just assuming that you have Alzheimer's or any other disease, but they should be looking for things like sleep apnea. And I would say that a doctor who has really has worked with people as they get older would know to look for sleep apnea as well as many other things. And that's why we say it's important with the 10 warning signs that you not assume if you have several of those that you have it. You've given a very good example here of it can be something else but look like Alzheimer's, and other people can think it looks like your granddaughter. She looked like, she wouldn't have called it Alzheimer's probably, but she was worrying about grandma losing her memory. So it's important that you go to the doctor and persist, because doctors, number one, don't always know all. I think sometimes we expect doctors to know way more than any person's capable of knowing everything that's out there. But you do need to persist in making sure, or go see a different doctor if they're not looking at things, and making sure of the alternatives it may be. I've heard of some young people that think they're losing their minds, their memory, and they go and find out it was stress. Yeah, thyroid, stress can be a lot of different things. So it's important that you do investigate that. That's a very good example. Thank you. Those communications are really important, that your doctor is understanding what's going on with you. Anybody else on on Zoom or here?
Yeah, I do have a chat. So to go off of what you said about stress, the comment is stress makes everything worse. And there's also a question, how do their eating habits change?
Well, eating habits, they'll change over time, because as you continue with Alzheimer's, it gets harder to swallow. So they literally will have to stop, to actually have soft diet and anything when you get into the severe stage. Otherwise, there's not much need for diet to change. We strongly recommend that people who have Alzheimer's are, as I said earlier, they're eating right, which means a balanced diet, and a balanced diet in the terms of how much you're eating, but also the variety of food you're eating, exercise. We learned during COVID how important social interaction was. So all of these things together can impact someone who has Alzheimer's and help them to alleviate some of the symptoms in that. It's all very important. Okay, let's see. We're going to look at the late stage now. The late stage, things you may notice. By now, they may usually not be talking very much at all, just using a few words or sounds, and just have a very limited range of responses to things. So it's going to be very important that you are paying attention, watching their facial expressions, listening to them to understand, are they in pain? And making sure that you're not letting pain occur, that their doctor's not letting them be in pain from something else. Again, UTIs are common, but other things can happen. Make sure a pain is being addressed at this time, because it's harder for them to explain what's going on with them. You want them to feel safe and hopefully happy with where they're at, being respectful of them in conversations. Keep talking to them. We talk about people in the hospital when they're in a coma, people tell them, keep talking to them. Same thing with Alzheimer's. Keep talking to them. It's important that they still hear people talking to them, even though it's difficult when they're not responsive. It's hard to talk to people when they're not being responsive. And again, we're going to really push in this section on using all 5 senses to communicate. So we've got another video.
I know that my mom feels aggravated. I know that she feels alone. I know that she feels confused. And I know on any given day, I don't know if I've made it better for her. I try. In these later stages, I've come to recognize that being really aware of the 5 senses is really important. Touch seems to give her a great deal of comfort. I know when I come over, I'm going to brush her hair all the time. And my husband noted to me recently, he said, you should see the look on your mom's face when you're brushing her hair. She's just happy. She's just happy. She doesn't say a lot. And I do it for a long period of time. I comb it, I braid it, I do funny things with it, but it just allows me to just be with her in a way that makes her feel comfortable.
So touch becomes very important. Did any of you watch the TV show This Is Us? Okay. If you watch This Is Us, the last season, the mother had Alzheimer's. And one episode that stuck with me is when she had 2 sons and a daughter, adult ones. The daughter told the 2 sons, "You're avoiding talking to mom. You're not talking to her as much as you should." And so she got them a bottle of hand lotion and had her brothers start putting hand lotion on their mom's hand and holding her hand as they were rubbing the lotion into her hand. And because of that, they started communicating with her. So it's important for people to understand the importance of touch, and that hand thing is one that has become important. And I thought this woman brushing her mother's hair was very touching to think of her doing that on a regular basis, and that her husband observed how much the mother noticed that and enjoyed it. So it's those kind of things you want to think about. But this gives you some examples of things. You can give them different fabrics to touch and to feel the difference between fabrics, to give them some everyday items in a bag and have them try to guess what it is they're touching, so that you're kind of continuing to try and help them use their mind in small ways. If they were a pet person, if you can bring, the dog to see them, or the cat, or whatever, or whatever animal it is that they liked. You talked about watercolors. Art's a big thing in assisted living facilities, having them do some kind of art, watercolors or painting of some kind. In this case, it talks about sculpting with non-toxic materials. Those are all things you can do for touch. For sight, we also talk about with Alzheimer's patients having photo albums of family members with the names of people's names on them, so they don't have to try. It's easier for them to remember people's names because they have that picture there on a regular basis. Photos, though, of even people they liked, famous, actors and actresses that they liked, having those pictures around, just to, again, you're trying to do things that stimulate their mind. It can be as simple as going outdoors with them and just having them, like this time of year, going out. I took my friend out the other day. She loves Halloween. And again, she's still in the mild stage, so she can still carry on conversations and everything. But I had driven down a street that had a lot of Halloween decorations, and it was right next to her building. So we went and had coffee, and then I said, let's go walk down this street. You're going to love it. And she did. She absolutely loves seeing all those decorations, and she wouldn't get to see them otherwise because she's in an assisted living facility. Connecting through sound, we've already mentioned music. Excellent way to help people stay in touch with what they really like. Recordings of nature, farms, cities, animals, playing a musical instrument or having the sounds of a musical instrument and trying to have them guess what instrument is that. Listening to songs or speech in their native language, reading books to them, or poetry if they like poetry, newspaper articles, keeping the tone of your voice gentle. So again, trying to use the sound. Smell, another one. You know, you can give them small bags of herbs or spices, cotton balls dipped in the essential oils, grass clippings. I still, and it's just a little thing, but I remember one time I hadn't been home for a long time. My dad was a farmer, and going out to meet him in, somebody told me he's out in the field over the such and such. I went out there and he had just mowed hay, and that visual and the smell of that is still with me. So those kind of things that meant something to them in the past can carry real meaning for them now. And the smell of foods that they liked, apple pie, chicken soup, those are important. And that leads to the last one, taste. As long as you're making sure you're not giving them foods that they can't swallow appropriately. Favorite foods. My uncle and mother-in-law, till the day that they died almost, would ask for certain foods. And, you know, we'd try to make sure we had them available for them because they just loved those things. It's possible that you get to the point that all they can handle is popsicles or ice cream and puddings, but trying to use, again, that sense to cause them to keep using their minds and to feel a part of life. So those are all important things in the last stage, which means by that time they're pretty seriously involved with the disease. So to summarize, make sure in any stage of the disease that you're focusing on their reality. That's the important thing. That you try to understand and accept things, even if you don't agree with them or you think they're wrong, just understand and accept. Make sure you think about their sense of self and the emotions behind why they're feeling so bad about something that may be happening to them. Treat them as an adult, not as a child, that they're sometimes behaving like children. But you need to try and treat them as an adult as much as possible. Make sure you think about the effects of your moods and your actions. We all have our days too. So how are you impacting on them? And then try to really understand their feelings and emotions behind their behaviors and help to meet their needs while you soothe and calm them. So before I show you a final video, are there any other thoughts? We've talked about the last stage and now overall, any other thoughts or ideas that people want to share from your own experiences? So she could ask if doctors have honed in on and tried to find out what is it that we can do to make them feel more comfortable and more like themselves. And my answer to that is, I know that this disease is being studied in all aspects. I've not heard of anything specific to what you're saying yet. We're learning so much about this disease as time goes on. I mean, last year was the first time they came out with a drug that can actually start dealing with the biology of the disease, what causes it, as opposed to before that, it was only medications that might help alleviate symptoms, which was doesn't do anything towards treating or curing. Now they're starting to get into that next stage. So they're continuing to look at all those things. They're not there by a long stretch, but they do what they can to make people feel comfortable in the sense of just like they would with any other person who is nearing that late stage, nearing death from other diseases, they would deal with it like a hospice, so that they would be dealing with pain medication and things to help, if they can see the person who's in pain and help them deal with that, to try and make them feel comfortable. Absolutely, that's happening.
Bev, a participant would like to know if there have been any studies related to changes in behavior. For example, if a person was always calm and mild-mannered before, would their behavior, personality, attitude stay the same, or might they become aggressive or change in other ways?
Yeah, there absolutely people change. I have done several of these sessions where I did a group of these sessions with a church group, and I got to know a couple of the spouses of people who had Alzheimer's. And the two of the men, I remember in particular talking about, she's not the woman I married anymore. And yes, people do in the late stages, middle and late stages. It's not unusual for people. I wouldn't say it's common, but it's not unusual for someone to become violent and aggressive in terms of language. One thing I failed to mention is, we often see people who have never cursed in their life, who with Alzheimer's go at it quite regularly and quite aggressively. If any of you heard of sundowners, okay, that's literally when sun goes down in the afternoon, people's behavior changes. And that's when I have heard, I personally have not seen this yet with any of the people I know, they can become very aggressive, very agitated, not sleep, keep their caregiver up all night. So yes, personalities definitely do change. I know they're studying it. Again, I haven't heard of anything in terms of dealing with that other than the way we would deal with anyone else who was aggressive or that kind of at that time of life. I want to finish with one quick video that I hope I'll get to. Yes, about caregiving. I think most of us know caregivers have to take care of themselves, but let's let somebody from Alzheimer's talk about that a little bit.
Taking care of yourself while you care for somebody with the disease not only impacts your own health, but it really can impact the person with the disease. So for example, if you're not getting enough sleep, you might be easily irritated, which will then sort of spill over to your interactions with the person with the disease and maybe being short with them, which then might cause them to get frustrated. So it's not only important to take care of yourself for your own health, but really for you to really be a good caregiver.
So by taking care of yourself, caregivers, we have what's called respite care, which is if you are literally the person that's living with someone with Alzheimer's, you literally need to take time off and get away for a while to get your own physical and mental health, keep it at a stage where you're going to be able to deal with the patient. It's extremely important for you to do that. I think we all know that. Doing it is a different thing, but it's extremely important. Caregivers have to take care of themselves, or eventually they're not going to be able to take care of the person they're taking care of. I'll finish with just throwing out here, if you've been to any Alzheimer's presentation, you've seen this before. I have magnets back on the table that won't help those of you on the line. But we have a 24/7 helpline. They can answer questions about just about anything from it's 2 o'clock in the morning and my dad is wandering around the house and I can't get him calmed down to go to bed. I've got to go to work in the morning. Help. They can answer those kind of questions. They can also help you with finding, helping you, giving you some guidance on finding doctors, on resources available in your community. They're master's degree people. They have over 200 languages available. It's all free, available around the clock, 365 days a year. Don't hesitate to call with any question. With that, I'll just say thank you very much for your time and attention. I hope this was helpful information.